Neck cysts, gentle actions to ease discomfort and reduce swelling of neck cysts. Are you experiencing discomfort and swelling in your neck? It could be a neck cyst. These pesky little growths can cause quite a bit of pain, but fortunately, there are gentle actions you can take to ease the discomfort and reduce the swelling. In this blog post, we'll cover everything you need to know about neck cysts, from what they are and their common symptoms to natural remedies and medical treatments that can help alleviate your discomfort. Don't wait to get help. Read on for our expert advice on how to deal with neck cysts. Overview of neck cysts. Neck cysts are common occurrences that may appear on or beneath the skin of your neck. These growths can be caused by various factors, such as an infection, blockage in a duct, or atypical cell development. Neck cysts can either be harmless and benign or pose potential health complications. There are several types of neck cysts depending on their location and cause. Epidermoid cyst is the most common type of neck cyst, which develops when skin cells grow within a blocked hair follicle or oil gland. Symptoms associated with neck cysts may vary depending on the size, location, and cause. Although some neck cysts require little to no medical intervention if they're not causing any symptoms, it's best to get them checked out by a healthcare professional to ensure they don't pose any risks to your health in the future. What are neck cysts? Neck cysts are lumps that form under the skin on the neck. They can develop in anyone, regardless of age or gender, and may be caused by a variety of factors. These growths usually appear as small bumps just below the skin surface and are often painless. A neck cyst is essentially a fluid-filled sac that forms beneath the skin. It develops when dead skin cells become trapped inside a hair follicle or sebaceous gland, leading to an obstruction. As pressure builds up within this blocked area, it causes swelling and creates a lump. There are several types of neck cysts, each with unique characteristics. Some common types include epidermoid cysts, dermoid cysts, and thyroglossal duct cysts. Epidermoid cysts form from cells found in the outermost layer of the skin, while dermoid cysts result from embryonic tissue that failed to completely disappear during development. Thyroglossal duct cysts occur when remnants of thyroid tissue fail to migrate correctly during fetal development. While many people live with these growths for years without experiencing any issues, others may require treatment if they become infected or cause discomfort due to their size or location. Types of neck cysts. There are several types of neck cysts, each with their own unique characteristics. One common type is the sebaceous cyst, which occurs when a hair follicle becomes blocked and fills up with oil or dead skin cells. Another type is the branchial cleft cyst, which forms from leftover tissue during embryonic development and typically appears on one side of the neck. These cysts may become infected or inflamed if not properly treated. Thyroglossal duct cysts develop from remnants of thyroid tissue that did not migrate to the proper location during fetal development. They often appear in childhood but can occur at any age and may require surgical removal. Lymphatic malformations are another type of neck cyst that results from abnormal growth of lymphatic vessels. They can vary in size and may cause difficulty swallowing or breathing if they grow large enough. It's important to note that there are many other types of neck masses besides these four examples, so it's crucial to see a doctor for proper diagnosis and treatment. Common symptoms. Neck cysts can present a variety of symptoms, depending on their type and location. However, the following are some common signs that may indicate the presence of a neck cyst. Painless lump or bump. The most noticeable symptom of a neck cyst is a painless lump or bump that feels firm to the touch. It may be small or large in size and located anywhere within the neck. Swelling. In addition to appearing as a visible lump, neck cysts can also cause swelling around the affected area. This might make it difficult for you to move your head or neck comfortably. Tenderness. Some types of neck cysts may cause tenderness when touched due to inflammation in the surrounding tissue. Redness and warmth. If your neck cyst becomes infected, you may experience redness and warmth around its location. You might also notice pus draining from it. Difficulty swallowing or breathing. Depending on where your neck cyst is located, it could interfere with normal swallowing or breathing functions if it grows too large. It's important to note that not all people with neck cysts will experience these symptoms. If you have any concerns about an unusual growth on your body, seek medical advice promptly. When to see a doctor. If you notice a lump or bump on your neck, it's important to pay attention to any accompanying symptoms and monitor the size of the cyst. In some cases, neck cysts can be harmless and go away on their own. However, there are certain situations where it's best to seek medical attention. If you experience pain or discomfort in the area of the cyst, this could be a sign that it is infected or inflamed. Other symptoms such as fever or chills may also indicate an infection. If the cyst is growing rapidly or becomes larger than 2 inches in diameter, this could be a cause for concern. It's important to have any unusual growths checked out by a doctor to rule out more serious conditions such as cancer. In some cases, neck cysts can affect your ability to breathe or swallow properly. If you experience difficulty breathing or swallowing, seek immediate medical attention. If you're unsure whether your neck cyst requires medical intervention, don't hesitate to consult with your healthcare provider for guidance and evaluation. Common causes. Neck cysts can develop due to various reasons. One of the most common causes of neck cysts is an overgrowth of cells that form a sac-like structure under the skin. Another cause of neck cysts is a blocked hair follicle or sebaceous gland, which leads to the accumulation and retention of oil and dead skin cells. This type of cyst is known as an epidermoid cyst. Trauma or injury to the neck area can also lead to the development of a neck cyst. In some cases, infections caused by bacteria or viruses may be responsible for forming these growths. Certain medical conditions such as thyroid disorders and cancer may also contribute to the formation of neck cysts. Additionally, genetic factors, hormonal imbalances, and exposure to environmental toxins are other potential causes. Identifying the underlying cause behind your specific case can help guide treatment options. It's essential always to seek medical attention if you notice any unusual swelling in your neck area. Early detection can prevent complications down the line. Risk factors. Certain factors can increase the risk of developing neck cysts. While anyone can develop a cyst on their neck, some people are more prone to them than others. One of the most common risk factors for neck cysts is age. As we grow older, our skin becomes less elastic and more susceptible to damage and inflammation that can lead to cyst formation. Another important factor is genetics. People with a family history of neck or other types of cysts are at higher risk than those without such a history. Hormonal changes may also play a role in the development of neck cysts. Women who experience hormonal fluctuations during pregnancy or menopause may be more likely to develop these growths. Additionally, certain medical conditions such as acne, thyroid disorders, and immune system problems may increase your susceptibility to developing neck cysts. Lifestyle choices like poor diet and hygiene habits or exposure to irritants like smoke or pollution could contribute as well. By understanding these risk factors, you can take steps towards reducing your likelihood of developing painful and frustratingly persistent cysts on your neck.